My name is Donna Kutzer, and I am the Development Director at the ARC of San Antonio. I'd like to welcome you all to, I guess, our third in the series for the March for Independence webinar series that the ARC of San Antonio has started offering since June. And if you're not familiar with the March for Independence, it was a fundraising information offering campaign, a full comprehensive campaign to help support the ARC and champion the ARC and the work that we do here, including advocacy and education. The series are a part of education. This series is brought to you by our sponsors, the Gordon Hartman Family Foundation, New Star, the Greehey Family Foundation, Valero, Jefferson Bank, HEB, the Mays Family Foundation, and the Harvey Najum Foundation. Today's session will provide you all with an overview of the following three diagnoses: intellectual and developmental disabilities, autism spectrum disorder, and specific learning disabilities. We hope that you leave this session with a better understanding and awareness of the eligibility, characteristics, educational considerations of each disability. So again, following the presentations, you'll get the opportunity to ask questions. We ask that you place them in the chat box, so then we will read them at the end and give everyone an opportunity to answer them. It gives me great pleasure to introduce Heather Long, who's the director of the Family Support Services program here at the ARC. Family Support Services provides help to caregivers in navigating programs and services. So please welcome Heather, and Heather will introduce our guest.
Thank you, Donna. First of all, I have to give a shout out to my friend Jane Tapmeyer, who got me in touch with these two lovely ladies who are going to be presenting today. Just a little background about why we picked this topic. You know, so many of our families and professionals, we say diagnosis, we use terms, and sometimes we don't really know what that term means exactly. You know, going throughout school, applying for government benefits, a lot of times it's based on a person's diagnosis. So I am really happy today that we are going to delve into that and help people, help myself, help other professionals, help parents, students understand what these diagnoses mean. And so I want to make sure to tell you about these lovely ladies. Dr. Allegra Montemayor, she's been in the field of special education since 2008. She's currently a program specialist in the San Antonio Independent School District, and she has continued her work as a researcher and adjunct instructor for undergraduate and graduate students at UTSA and other local colleges like Our Lady of the Lake University. So I'm really excited to have Dr. Montemayor with us. Yeah. And also Kathy Ewalt is a special education researcher, and she focuses on interventions and accommodations with an emphasis on learning disabilities. She's an assistant professor in the interdisciplinary learning and teaching department at UTSA. And that's not all. So if you want to know everything that they've done, you go back to the introduction or the invite that you initially received, and you'll see everything that they've done. So I'll go ahead and turn it over to our ladies, and then again, if you have any questions, put it in the chat and we'll address those at the end.
Awesome. Thank you so much, Heather, and thank you everyone for being here. So I'm going to go ahead and share my screen, and to provide optimal viewing, let me make sure I tweak my settings. And can y'all see my screen, Heather? Can y'all see my screen by any chance? Oh.
Yeah, we see it. We got it.
Okay, awesome. Sorry, just wanted to make sure.
Yep.
So yeah, once again, Dr. Ewalt and I, we're so excited to be here. We understand the relevance and the importance of sharing this kind of information to the community. The participants, please feel free to share the role that you currently play, whether it be a parent, a caregiver, a student, someone that works in the field, just to kind of give us an idea, and go ahead and indicate it in the chat box. So this is our presentation agenda. We will, as Heather discussed, we're going to talk about intellectual and developmental disabilities, and then we'll go into autism spectrum disorders and learning disabilities. We will have time for Q&A at the end, and so again, it would be great if you could write those questions down in the chat box. We would love to address those once we're done with the information. We have a lot of great information to share. So these are the objectives. So we're going to provide a definition, including eligibility for every single one of those disabilities that I just mentioned. And then we will provide some very general characteristics of what that disability is. And then we'll talk about some educational considerations. So essentially, what does this look like for our students in the classroom setting? And then lastly, we'll talk about what happens after they transition from, being in a school age or in a public school setting. What does life look like? And so we'll talk about those lifelong implications after, once we go through all of those other objectives. So just to kind of give you an idea where we're headed. So once again, my name is Allegra Montemayor, and I am an adjunct for the University of Texas at San Antonio, and I will be presenting on intellectual and developmental disabilities and autism. So just to preface, I think it's really important to talk about how far we have come with respect to intellectual and developmental disabilities. So as a result of the negative connotation people have with the term intellectual disabilities, I mean, we've come a long way. As you may know, we used to refer individuals with intellectual disabilities as mentally retarded or mental retardation. So fortunately, through Rosa's Law, which is a federal law, it ended the use of the term mental retardation, and this is something that we teach continuously, that person first language to our students, our pre-service teachers, and even at the district level, to acknowledge that, we've come a long way and we're evolving as we speak. But I do want to make note of that. And also, another thing that I want to mention is we're going to use some of these terms interchangeably. Like, for example, I often refer to it as intellectually disabled or intellectual disabilities, but we also talk about it as intellectual and developmental disabilities. So IDD, ID, but it's all really the same thing. I can tell you at the district level that I currently work at, we refer to it as intellectually disabled, but we're talking about that same umbrella. So. And intellectual, of course, is more appropriate than mental retardation. So that's obviously something that we really want to push forward with the community, because it's important. It's important to acknowledge those changes. So with every disability, I think it's really important and relevant to talk about the definition or the eligibility. So essentially, we have a child who has been diagnosed, that's coming into the school system. So we often have to look at, okay, so what makes this student have an intellectual disability? So from an educational standpoint, it's important to understand, what does Individuals with Disabilities Education Act say with regards to this particular disability? So within the definition, and by the way, IDEA is part of the American legislation that ensures that all of our students that are serviced in K through 12th grade are provided with free, appropriate public education, and that we're providing them with a program that is individualized and that is unique to them. So that's what I mean when we talk about IDEA. But part of the definition is specifically for students or children who have an intellectual and developmental disability, specifies 3 specific criteria under this definition. So in order to qualify, first off, for an intellectual disability, it must start at any time before the child turns the age of 18. Then we look at these very specific categories. So we're looking at their intellectual functioning or intelligence. And that includes their ability to learn, their ability to analyze, to reason, if they're given a problem, being able to problem solve, and any other skills like life skills are also included. Secondly, we also look at their adaptive behavior. So an individual must have a significant difficulty with tasks of everyday living. And when I say everyday living, it's, brushing their teeth, conducting their morning routine, making sure that they're getting ready for school, getting on the bus, preparing their meals, holding a fork, holding a spoon. That all makes up those everyday life skills. So we're looking at those two very, very specific criteria when we're talking about individuals with intellectual disability. So their intellectual functioning and their adaptive behavior skills. And in both of those categories, we need to see some kind of significant delay for both. And lastly, the deficits must occur during the developmental period. So hence why we also refer to this population as intellectual and developmental disability. So that this in particular will help us distinguish intellectual disabilities from learning disabilities, which Dr. Ewald will cover towards the end. So these kinds of deficits kind of help us distinguish one from the other. And lastly, with regards to the definition, we look at classifications. So more specifically, when we look at the definition, we're looking at the problems in adaptive behavior, not just intellectual functioning. But when we do look at intellectual functioning, school psychologists, their job is to look at, where does this child fall under in terms of their IQ score. So any child below the score of 70 is considered someone who has an intellectual disability. Now, we look at these classifications by the degree or level of impairment, and it is measured by those IQ test scores. And while this is not absolute, we're not just looking at these scores, I think it's still important to, at least give us an idea of where they are at in terms of their level. And it helps us, make some, decisions. But this is not just an end-all, be-all. We look at everything. But this is just something that we, it's important to just keep in mind that we look at these scores in terms of where they are in their severity. So as far as characteristics, the rate at which children with intellectual disabilities acquire new knowledge and skills is way below that of children without disabilities. And that's something that we could already attest to once we look at, the definition, because we are looking at students who have, significant level of difficulty and challenge in everyday kinds of activities. So to illustrate, these children with intellectual and developmental disabilities have difficulty with their working memory. They have difficulty remembering information. They are much slower to attend to relevant features of a learning task. So we always prep teachers just to, make sure that they're giving the child enough wait time to sort of process the information, and then whatever it is that the child needs to do at that time, that we're giving them that information for them, because it's going to take them a little bit longer to attend to specific tasks. Secondly, it affects them in their attention. So they may have, there may be a lack of interest in learning or in problem solving. So that kind of goes along with that motivation. It's really important to always look at, what reinforces this particular child. And that's very relevant for children with autism as well. But you're going to see some overlap. We definitely want to look at what motivates them, because at some point they will feel like, they're falling behind. They're not like their typical developing peers. And so it's always important, and we ask parents and teachers to always look at, what reinforces this particular child, what makes them, interested in learning and in growing. And so it's really important to have those conversations. And I'd mentioned adaptive behavior in the definition. So there are significant limitations in self-care and daily living skills. And so that will impact not only just, everyday skills that they perform throughout the day, but we also have to keep in mind that it's going to impact their social relationships. So what I mean by that is socially, being able to make friends, keep friends, maintain friendships, start, those conversations with their peers, and, knowing what to say and kind of getting them out there and included. And so it's important to understand, life skills are part of, what we do day in and day out, but we also have to acknowledge that those social relationships are just as important, because we do want them to be included and, have those opportunities with typical developing peers. So that's another area to stress. As far as behavior excesses and challenging behaviors, every child is different. It's very difficult to say, every child with an intellectual disability is going to have some behavior concerns or challenges. I mean, that's not the case with every child, but I think it's important to note that because every child is different, I think it's, we need to look for those kinds of behaviors that may impact their learning or, the learning of others. So we may have in some cases individuals with intellectual disabilities display some, off-task behaviors, non-compliant behaviors. And so, but we do look at that case by case, but it's just, just something important to note. And, and that's something that we always want to make sure that we, let our students, our teachers, and our parents know. In terms of curriculum goals, I don't want to go too much into this, but just from an educational standpoint, the focus of educational programs, again, it will vary individual to individual. So we really need to look at the degree of a child's intellectual disability and really how much support that child needs, either in the classroom, at home, out in the community. So again, with those individualized education programs, those IEPs, we are tailoring those programs to meet the needs of that particular child. So first and foremost, in an academic educational setting, we want to look at their the academic curriculum. So we want to make sure that they're provided with TEKS-based grade level objectives. And so while they may not be at that point where they are grade level, we're certainly looking at all of the prerequisites, in order to get to those objectives. And so yes, we want to provide them with reading, writing, math, all of those different academic objectives. And then secondly, of course, because we do have some adaptive behavior deficits, we certainly want to look at functional curriculum. So not only are we teaching them academics, we want to tie in those academics to, functional, what we call functional academics. So if we're going to talk about math concepts, then let's tie in some, some other concepts that we can do, like life skills. So for example, let's learn how to fold our clothes, but wait, let's look to see if we can categorize the laundry. So we're going to match by shape, we can match by color, we can count. And so it's important that we provide and we embed these kinds of opportunities into either the home setting or the classroom. And of course, I will mention self-determination later on in the presentation, specifically when we look at the transition into adulthood. But people or individuals with intellectual disabilities, they of course have the same right and the same responsibilities that accompany self-determination, just like anybody else. So we certainly need to recognize that and understand that they have the right to, make decisions about, what they want to learn, obviously with some guidance and some coaching, but we do want to, offer that and be respectful of that as well. So, because we do want them to, to recognize that and have those self-determination skills. So what does that look like in the classroom? So these are just some educational considerations, and I'm looking at the time. I probably need to kind of speed it up a little bit, but we're going to see some overlap here with what we do in the classroom to help support students with intellectual disabilities. So one of the key elements of instruction, and these are all taken from research, and everything we do must be research-based. But first and foremost, even before I go into these, it is very important to assess assess where each child is. So what are their present levels of performance? That's what we go off of, really, to look at, you know, what do we have? What are we working with? And where do we need to go from here, basically? So we need to identify and prioritize the most important instructional targets. And I would say that that is relevant across any disability that we service in special education. So one of the educational considerations is task analysis, and I think for those parents that are here in the Zoom, you know, breaking a very large or big step or big activity into smaller steps. When we do that often, especially with students with intellectual disabilities and autism. So really looking at, you know, in order to learn a new skill, we need to break down that big skill into smaller steps. In terms of the classroom, of course, this is going to look different for the classroom than in the home, but we want teachers to design instructional materials and activities so the student has frequent opportunities to respond. And that could be in the form of guided practice, independent practice, you know, making sure that we're offering those opportunities in the classroom. And that, of course, can, you know, look somewhat similar, but in a more natural setting, like in the home, you know, providing them with those opportunities to respond. And with that said, the transfer of stimulus control, it's when we provide prompts. So it's, you know, when we give them verbal prompts or we give them physical prompts or when we provide them with gestures, it's important that we always do that. But then it's even more important that we fade those prompts so we're ultimately giving them more access to being independent, because we don't want our students to be, you know, prompt dependent is what we call it. So that's what we mean by transfer of stimulus control. And of course, we're providing them with reinforcement and, you know, good job, and I love how you're doing that, I love how you're sitting, things like that. And generalization and maintenance, this is when we teach skills in the classroom and we want to see those skills generalized in the home setting. That's why the communication and the collaboration amongst teachers and parents and guardians is so important. That communication should be ongoing, just so that we're on the same page, because we remind teachers, like, you know, we're all team players. You know, we're on the side of the parents. You know, we want to make sure that we're all on the same team. So just something to keep in mind. And I'm just for time purposes, I'm going to skip through that slide. So the transitioning to adulthood. So really, what does this look like for individuals with intellectual and developmental disabilities? So that transition planning and the programming focuses first and foremost on those life skills. So, and those life skills will accompany with the employment skills and self-determination skills. Now, although the emphasis on transition programming increases as students get older, and they move into, you know, for example, they're moving into middle school or in high school, districts are pushing these conversations of this kind of programming at the very, you know, at the elementary years, and it should begin in the elementary school years, because we have to understand that some of these organizations that will assist our community, our individuals with disabilities, you know, they have wait lists, and some of them are for years, a very long time. And so we often ask our transition specialists to be part of those IEP meetings early on, just so that the parents feel that they're equipped, just to understand, you know, this is what it looks like moving forward. And you know, it could be a little bit difficult, some difficult conversations, but we do want to provide that opportunity to the parents early on, because that is very important, this particular topic. So of course, the domestic skills, you know, what are they able to do in the home, the employment skills, if that's something that the individual can do. Of course, this is all based on their levels of performance, you know, their social skills. Is this something that's appropriate for the individual? It could be that supported competitive employment is an option, structured workshops, or excuse me, sheltered workshops. But these are all conversations that we need to have around, you know, students that are approaching this particular secondary school age. So just something to keep in mind, that we look at all of these different domains. And of course, all of this leads to that self-determination, those self-determination skills that we ultimately want our individuals with intellectual disabilities to have, to feel empowered, to act autonomously, and to make those decisions for themselves and what they want to focus on as they transition into adulthood. We have some resources that we'll be sure to, this slide will be posted. So just know that you can always go back to this slide. And if you need any additional resources with respect to intellectual disabilities. So now I'm going to present on autism spectrum disorders, and I'm going to follow the same agenda. I'm going to talk about the definition, the characteristics, what it means in the classroom, and some implications for transition programming. So with respect to autism and other disorders similar to it are now typically collected under the broader term of autism spectrum disorder. So I may refer to it as autism, ASD, autism spectrum disorder, but I'm talking about the same thing. These disorders are similar to in that all involve some social communication impairment and repetitive and restricted behaviors. So we're looking at very specific domains. We're looking at behavior and we are looking at communication. So we know that autism is a developmental disability. We know that for sure. And we start to see signs of autism or characteristics of autism before the age of 3. Now, I have met with parents and I've interviewed parents for, for different research projects, and I have had parents tell me that they noticed it right away, even, before the age of 1. And, of course, our parents know their children well, but we're seeing these kinds of characteristics before the age of 3, and it affects their verbal and nonverbal communication. So they may develop words or they may not. They may not be able to socially interact with their siblings, with their parents, with their peers, but that's what we know, is that it's affecting their social and their communication, and we see how it impacts their behavior. So with that said, based on this criteria, in an educational setting, these are domains that adversely affect a child's educational performance. Okay, that's what we look at with its definition. Along with the definition of autism spectrum disorders, and most of you or some of you may know that we look at, it's a continuum. We have students with very mild autism where they're serviced in a general education setting. And they need, some support with their social communication, their social skills, but otherwise they may be on track. They may demonstrate some high academic achievement skills, but their communication may be impacted. And so, they could be on that end of the spectrum. Then, of course, we also have children who are in the more severe end of the spectrum, and that's where we start to see a lot of the behaviors, because more than likely that communication piece is impacted. So, just imagine if you cannot communicate need and want, there's going to be some behaviors there. And so it's important to note that it is a spectrum, and we will see a varying degree of levels within this particular disability. And based on the Diagnostic and Statistical Manual of Mental Disorders, or what is a DSM, this is a handbook that's used for healthcare professionals, but it's very much in line with what we look at from an educational standpoint. But what they notice is, yes, that there's social communication impairments, and there are repetitive behaviors that they observe from these children that have autism. And they also note that all of these different characteristics begin in early childhood. So they start to see that before that age, that age of 3. And based on those, they must demonstrate that it's creating a challenge in everyday functioning. And it kind of goes along with those like life skills. So it's impacting their everyday functioning. Because autism occurs along a continuum of severity levels, there is going to be some variation in the behavioral characteristics that are associated with autism spectrum disorders. So individuals or children with autism, we're noticing that they have problems with their social interactions and impaired social relationships. So, going back to that communication piece, and then not understanding those social cues, or, what happens, when they're around peers or around, someone, their age, it's going to impact that social relationship. So some children may exhibit some extreme aloofness, meaning they may not be paying attention to you. You may have this awesome, super cool toy or book or something that you're showing them, and they may be into something that's on the wall or something that is just maybe in your eyes, it's not so significant, but they're focusing on something else. And so it's part of that extreme aloofness. They may have some social situation difficulties. And when we talk about theory of mind is necessary to understand that other people around them have, these beliefs, and they have these emotions, and they have these desires. But for individuals with autism, they have a very difficult time with that. They have a difficult time understanding that it's not just about them. And they often say, autism, they're kind of like in their own world. And so when we talk about deficits in theory of mind, that's exactly what it is that they're not really understanding that other people around them, have these feelings, have perspectives on, what's happening in the environment. So that's what that theory of mind is. And that joint attention, that's when you have two children that are shared, that they have this shared focus on something, and it could be a toy, it can be a book. And so that is that joint attention that we want to see. But with children with autism, we often see them, playing by themselves or with them, just by themselves. And they could be happy, lining up toys or putting puzzles together. But that's something that we want to teach. We want them to be able to share those kinds of experiences with their peers. Then we have communication and language deficits. We may have children with autism that may never learn to speak, and they may have, we may teach them another mode of communication, but they may not be able to verbalize that. And so that's one aspect. We do have another concept called echolalia, and this is very common for those that can verbalize. And echolalia is basically what they're repeating what you're saying. So if you ask them, "Hi, how are you?" they may respond with, "How are you?" Or, "Hi, my name is Allegra," and they may say Allegra, So that's that echolalia. And so that's quite common for those that can verbalize. And even just looking at concrete or literal processing, especially for students who are at the higher spectrum, they take everything literal. So when you do make jokes, like break a leg, that's something that they may take, literally. And so just something to keep in mind when you are in social settings or social environments with individuals with autism in the more mild spectrum. Repetitive, unusual behavior patterns. Some children with autism may exhibit these sort of intense interests in particular toys, activities. They may display some motor, stereotype motor or verbal behavior, which include like twirling and spinning objects, flapping their hands and rocking back and forth. Those are these repetitive and persistent behaviors. And it's usually, and it could be unusual to someone that does not know autism. And so, but oftentimes those kinds of behaviors kind of just make them feel a bit more comfortable in their environment. They also have, children with autism have an insistence on sameness. So we are always telling teaching our pre-service teachers and our teachers that are currently in the field, to always have these routines and structures embedded within the school day, and even for parents. And parents, we understand how difficult life can be, especially nowadays in light of COVID-19. But we often stress the importance of keeping those routines as best as you can, of course. And teachers are always provided with with some guidance, just to kind of give the parents some feedback on what that could look like, because children with autism have a very difficult time if there is no structure and routines in place. So just something to keep in mind, that they do like everything the same, and they like to have those routines happen at the same time every day. And so just something to keep in mind. And for some students, they may respond in a very unusual way to sensory stimuli. So this could be, how they're receiving the information. Either they're hypersensitive, where they're receiving too much information. So, and that's where we see maybe that more of that hand flapping. I've had students screech and, make loud noises. I mean, you can see it. You can see it manifest, and those are those that are hypersensitive. And it could be noises, it can be things that they look at, it can be food, it can be fabric, texture on their skin. And then versus hyposensitive, where they receive too little information. So maybe they're not able to hear certain sounds. Certainly I had students that just didn't feel pain, like we do, that they could kind of, it's just a very different way of reacting. And so, so those are some other characteristics of autism. I'm just gonna kind of skip through this slide. Because Kathy, I'm sorry, I'm looking at the time, and I am kind of winding down on this. So I think it's important to along with the communication piece, I do want to stress the importance of acknowledging that if there are deficits in communication, we are going to see some behaviors, and more than likely they're going to be challenging behaviors. So some, and I'm not saying all, but some individuals with autism may exhibit some kind of aggression, either to themselves or to others, and that's what we call a self-injury. And it could be that they're frustrated. Again, every behavior communicates intent. If they don't have the ability to communicate, we will see these behaviors manifest in the classroom or in the home setting. We have seen parents report, and research as well has shown that we have children with autism that do have some sleeping problems, that are awake all night, and once it's time to go to school, they're at school, and and they're running on little sleep. That's something that we have found. We've also seen children with autism have a very extremely narrow food preference. So they eat the same thing every day, and they're not open to other foods. And along with that, we have seen students that love to put things in their mouth, and it could be non-edible kinds of items, and that's what we call pica. And that's like a compulsive thing, really, is where they put things in their mouth. It could be sharp objects, God forbid, but that's just, it's texture. It's, something that makes them feel good. And so we could see that, and we could see that in defiance. If we tell them to perform a task, they may perform, some kind of behavior that is inappropriate, because they're, they don't want to do it. They don't want to complete a task, or they're being defiant. And so, these are things that we, that we have to understand, that we may see for children with autism. So just to kind of narrow this wind down, I think probably the most effective thing that we can do as parents who have children with autism, or if we have teachers here, is the idea of early intervention. The most effective early intervention programs are intensive, they're highly structured, and of course we involve the families, which we're so appreciative of the ARC to provide this for parents, because we have a lot of parents that have questions, and I think it's important to give parents a voice because they're part of that IEP, they're part of that individualized education program. So we want to provide families and children the opportunity and entry into programs as early as possible, especially if the child has just been diagnosed. So that is something that we often want to stress. And of course, there are other evidence-based strategies that have scientific evidence, including applied behavior analysis. And teachers do all kinds of concepts under the ABA window, and it applies to the science of behaviorism. So this is where we look at bringing meaningful change in a student's actions. And so oftentimes when we look at behaviors, we need to look at what happens before the behavior, what is a behavior, and what happens after the behavior occurs. And so this occurs really through observation, but it's really important that we have some information about the behaviors, and it helps us understand what is the individual trying to communicate. And so it helps us develop positive and appropriate behaviors along the way. And in fact, most parents use a form of ABA on a daily basis, and you may not even realize it. But you may, provide them with a reinforcer after they completed a task or their morning routine or they ate their breakfast. Those rewards and consequences can make a behavior either increase or decrease. So I think all of us, to a certain extent, are doing that already in the home setting. Those visual supports, these can be used, these are universal, but visual supports are shown to be successful for students with autism. Anything that you can provide in a visual modality will help increase the success of a child performing that particular activity. So you may be familiar with the first then board. So first eat, then play. It can be as simple as that. Those visual activity schedules and also social stories are two very widely known strategies for children with autism, and we use all kinds of visuals. It can be these graphics, it could be a checklist if it's someone that's a little bit on the higher end of the spectrum. But numerous studies have shown that these kinds of visual supports will help them carry out specific activities, either learning or life skills kinds of activities. And social stories. Social stories are also another research-based intervention, and in some districts they call them social narratives. But these are individualized short stories, and they're a form of a social learning tool that supports that meaningful exchange of information that occurs between the child and the parent or the teachers. And it could be for individuals with autism of all ages. And you can do a social story. This is an example of when they go to the movies, preparing for a fire drill, their morning routine, going to the grocery store. As long as you have, sentences. So what is this going to look like? Perspective sentences. So, from that perspective, it could be a little scary going into the dentist office, right? But we're preparing them for the event, and we're providing them with directive sentences. So this is what it's going to look like, right? But then those affirmative sentences is like, going to the dentist is fun, so we're trying to encourage the child to go through with it. But at least through the social stories, it helps them with that anticipation. Going back to those routines, they don't do well with surprises. So if we can do, even a short social story just to kind of help with that anticipation, then we're building them up for success. And lastly, with the transition into adulthood, so this is really twofold, right? Because we do have individuals, again, this is a spectrum and it's a continuum from mild to severe. So for individuals with more severe forms of autism, as with individuals with intellectual disabilities, the emphasis in transition is on person-centered planning, We could look at potential living arrangements in community residential facilities, or living situations that are supported with, by personnel and people on staff. There could be some conversation around competitive employment, or even supported competitive employment, really just based on, what the child can do. And for individuals who have less severe autism, really the focus in transition is often on improving those social interactions, right? I mean, again, they could be on target, successfully they've met their academic objectives, but again, the social piece is impacting, how they navigate through the environment. And so the focus there will then shift into improving those social interactions. So, and that's both on site and, on whatever store or whatever setting they're in. And it could be something that we're already prepping them in the school setting. So, and one way of doing that is teach them, some social competency, right? I mean, to kind of, gain those skills through role playing, for example, presenting them with a situation and, what would you do, right? I mean, the best way to learn is to offer them those kinds of scenarios. And then the teacher or the parent or an individual is there to sort of coach them and provide them with that meaningful feedback. And so that makes it very real and relevant for them. So, and of course, there's some resources here for autism. So this concludes my half. Kathy, I'm going to stop my share, and I'll have you.
All righty, thank you, Dr. Montemayor. That was awesome. Lots of great information in there. I'm going to go ahead and share my screen.
And Dr. Ewalt, while you're doing that, I just want to, somebody had put in the chat, I wanted to kind of just make a comment. ACOG, Alamo Area Council of Governments, is a very important agency to Guadalupe Abundas. Thank you for putting that in the chat. Very important agency for families and educators to know about. It's kind of the primary agency that serves individuals, helps them get on wait lists. If any families or parents or educators need more information about what ACOG does or what waitlist we're referring to, you can contact the ARC, ask for me, ask for a case manager of the day, and we can kind of clarify some of that. And just for time's sake, we're going to probably go over about 10 minutes. We want to invite people to stay with us, and we're going to extend it a little bit just so we can make sure we get all the information from Dr. Ewalt. So please feel free to stay with us. There we go. Thank you, Dr. Montemayor.
Thank you.
Alrighty, and I will try to go through this as quick as I can as well.
Yeah,
so
take your time.
Type of things that Dr. Montemayor went over: definition, characteristics, educational implications, and long-term outcomes for students with learning disabilities. I have here 3 different terms of what it is known as, and it just depends on whether or not you're coming from an educational perspective, a legal perspective, or a medical or clinical perspective. In education, we usually use the term learning disabilities. Specific learning disability is the legal term, and specific learning disorder is more of the medical or clinical term. So unfortunately, learning disabilities is one of those constructs that we have a really tough time defining, and we've been struggling to define it since the late 1800s, which I thought was very interesting, as early as 1877 in Europe, and then in the late 60s here in the United States. So the current definition, according to the Individuals with Disabilities Education Act of 2004, is actually very, very similar to the original definition. So even though we've gone through many iterations and attempts to define it, we're sort of back to where we began. And it is a disorder of psychological processing that manifests itself in many different ways. Maybe the ability to listen, think, speak, read, spell, or do mathematical calculations. It does include perceptual disabilities. It may include people who've suffered a traumatic brain injury or have minimal brain dysfunction. It does specifically includes dyslexia as a form of a learning disability and developmental aphasia. However, these are things that are excluded. If a student has any of these types of issues, then they would fall under a different diagnoses, not under learning disabilities. It cannot be a problem due to vision or hearing, motor function, intellectual disability, emotional disturbance, environmental, cultural, or economic disadvantage. And included in that environmental disadvantage is also poor instruction. So one of the things that is required from IDEA is that students are used research-based and scientifically based practices in order to ensure that they're getting adequate instruction. Here are some misconceptions about people with learning disabilities and the causes and the correlations between it. It is definitely not correlated with IQ. Learning disabilities is the highest category of all students with disabilities. Approximately 34%, I think it is now, of all students with disabilities have learning disabilities. And about 5% of all students in the general population have a learning disability. I think very interestingly is the fact that they don't know exactly, there's not a lot of research done yet on, or still, on students who are twice exceptional with both learning disabilities and giftedness. And the estimates are anywhere from 14 to 33% of students with learning disabilities are twice exceptional and also have giftedness. The issue though is that one will often mask the other, and that's why it's difficult for us to determine that. In order to be eligible for special education services, the disability has to have an adverse educational impact, and that is probably one of the key features of whether or not a student qualifies to be served for under special education law. If a student has a learning disability, but it is not impacting their education at school, then they wouldn't necessarily qualify. They may be eligible for accommodations and modifications under the Section 504 of the Americans with Disabilities Act, but they wouldn't be specifically serviced under the IDEA. There are 3 different identified methods to determine if a student is eligible under the category of learning disability. However, the first one is called dual discrepancy. That was the most popular prior to 2004. And what that involved is a student would have to have a severe and significant discrepancy between what they are actually achieving and what their expected achievement was based on their IQ. So if a student had an average to above average IQ, but their achievement was at least 1.5 or more standard deviations below what they're expected to be able to do based on their IQ, then they were considered to have a discrepancy between, and that would be cause for eligibility for learning disability diagnosis. Now, in most recent years, since 2004, the most common use is called RTI, which stands for response to intervention. And I'm going to go into that in just a minute. And then there's another one that's called patterns of strengths and weaknesses, which is really rarely used, but it is mentioned in the law. I talked about the dual discrepancy. The key there is that the learning difficulties are not explained by intellect or cognition abilities. So RTI has 3 tiers. The first tier is in the general education classroom, and this is to ensure that qualifier that the learning difficulty is not due to the environment and not poor instruction. So all students are in tier 1 in general education, and all should be using, all teachers are supposed to be using research-based and evidence-based practices. If a student is suspected of having a disability or having difficulty, then they are progress monitored and data is collected anywhere from usually around 6 weeks to determine if they are able to progress as you would expect them to in that typical classroom environment. If they do not respond to the evidence-based practices and scientifically based instruction in the general education classroom, they may be moved up into what's called tier 2 of RTI. Here they meet in small groups, and they meet usually it's 3 to 5 times per week. And again, they are progress monitored for 6 to 9 weeks again, and whether or not they respond to that intervention determines whether or not they would move into tier 3. Tier 3 is more one-on-one, it's more intensive interventions, and it's typically 5 times a week. If a student, again, does not respond to this level of intervention, then they are referred to special education services, where they would be evaluated by an educational psychologist. So it does require parent consent, and the school actually has timeframes that they have to respond to parent requests within 45 days. One key thing about this is that in the whole eligibility process and even in the IEP team development is that parents are a key factor in the team. And so if you are a parent of a student with a learning disabilities, you should expect, and if you're not finding this to be true, then go ahead and speak with your educators that you're an integral part of the development team of the individualized education program for your student, because you know your student a lot better than we may. You've known them for a lot longer than by the time they get to school. There are lots of different types of learning disabilities. Most common is dyslexia or a reading disability associated with language, and it can be either expressive or receptive or with a math disability. And a lot of it has to do with deficits in working memory. This is the idea that it's different from short-term memory in the idea that as you are holding information in your brain, you are also responding to additional information. So you're listening to me, you might be trying to remember that you want to make a phone call, or you might be trying to remember somebody's phone number or a list or something else, but you also have my voice coming in, you have the print of the screen coming in, you have the light stimuli, and it's all the things that your brain is doing to keep all of that managed is working memory. And they're finding a lot of research points to deficits in working memory, and there's different components that, depending on what the disability is, that are implicated. Okay, dyslexia is most often implicated with the phonological component of working memory. Let's see, and these are just how it manifests itself. Texas is interesting. Texas does not service students with disability under the Individuals with Disabilities Education Act. They actually do under Section 504 because they have a specific educational programming for dyslexia, which I think is very unique compared to other states. Learning disabilities is not about a student being lazy. That has nothing to do with them not being motivated or not being engaged. It is not about their lack of ability to try. Okay, many times students are really working as hard as they possibly can, but still having difficulties. As far as education, accommodations and modifications are very beneficial. They require direct and explicit instruction where things are systematically presented, usually in chunks of smaller bits of information with learning aids such as mnemonics or even a checklist that helps students understand what comes next. So they don't have to keep all of that in their working memory. They have something that they can refer back to. These are just some other modifications and accommodations that are common for students with learning disabilities. I will mention metacognitive skills, and this just has to do with learning how to learn and learning different strategies. For instance, with writing, there's a strategy called POW plus tree, and it tells the students, okay, I have to plan my writing, organize my writing, and then write. And then in my writing, I have to include a topic, reasons, explanations, and an ending. So that's what the POW plus tree mnemonic refers to. There's lots and lots of different strategies teachers will use. Lifelong implications. College is absolutely an option for students with learning disabilities. It's important though that when students go to college that they identify themselves with student support services, and they can use their high school IEP as a basis for the college to develop whatever accommodations and modifications may be appropriate for their programming. Unfortunately though, you do not outgrow learning disabilities. It is a lifelong issue that individuals will continue to struggle with. So some people that you may know that also have a learning disability. I just wanted to include this because I think it definitely gives us hope. There are numerous people who have become quite successful in life despite their learning disability. And here are some of the names. I also included a slide of additional resources if you need more information about learning disabilities. And of course, we will provide our emails as well and phone numbers. So if you have any other questions, I'd be happy to answer. And I think that's about sums up my portion, Heather.
Awesome. Thank you, Dr. Ewald. I think Donna's going to come on and field some questions here.
Yeah, I am. Thank you so much, both, for your time and the information you shared today. We did have a question What medical professional diagnoses autism, intellectual disability, and learning disability?
I'm sorry, can you repeat the first part? I'm sorry, I missed the first part.
What medical professional? So who helps diagnose autism, intellectual disability, and learning disability? Who handles the diagnosis?
So we look at the medical professional, so like the neurologist, or it's like, especially for autism, we do have some pediatricians that are, that's what they specialize in. But once they're in the school setting, if they're coming from another district, then we look at, paperwork, and we have to see evidence of, a diagnosis. But from an educational standpoint, the school psychologists are equipped to evaluating students for different disabilities. And so they look at very specific instruments and evaluative techniques to look at what really is going on. So from an educational standpoint, it would be a school psychologist in collaboration with paperwork that the parent brings in from their physician or a neurologist, for example.
Okay. We had another question. Is ADHD a learning disability?
Actually, no, but there is a lot of comorbidity between those two. So one of the defining characteristics between the two of them is, like I said, with a lot of times students with learning disabilities are trying as hard as they possibly can to learn, but they're still having difficulties. With kids with ADHD, a lot of times they're not able to attend to that persistent attempt. But approximately 50% of students with learning disabilities also have ADHD or ADD.
Okay. I don't think we have any other questions. So again, thank you both so much for your time and the information you shared today. Thank you, Heather, for helping us pull all of this together. I also want to acknowledge and thank Sarah Kazin, the Development and Communications Coordinator here at the ARC. She truly is the glue who holds our webinars together. So without her, I don't think we would be able to do this. Later today, you'll receive an email with a survey for feedback on this webinar. The survey will also ask for ideas you may have for future webinars. The email will also contain a link to the recording of this webinar on the ARC's YouTube channel for you to refer to later, as well as the presentation. So you'll get all of this information today. Again, I want to thank our sponsors for making the March for Independence webinar series possible: the Gordon Hartman Family Foundation, New Star, the Greehey Family Foundation, Valero, Jefferson Bank, HEB, the Mays Family Foundation, and the Harvey Najum Foundation. Please visit our Facebook page for future March for Independence webinars. We plan to host at least 1 or 2 of these a month via Zoom, so we hope we can reach more people. And someone did remind us on the chat, so I want to bring it to everyone's attention. Obviously, the 2020 election is coming soon. So we encourage you, if you're not registered, to please register to vote, because your vote helps choose the candidates that will run our government. And they are truly the ones who can make a big difference for people with intellectual and developmental disabilities and their families. So thank you all so much for joining us today. We hope we achieve the expectation and your expectations. Have a great day, and please take care and stay safe.
Thank you so much, everyone. Thank you.
Thank you, ladies.
Bye.